Thank you. Final speaker, and I don't know if you're going to tap that, but the mic is yours. Andy Coates.
Well, it's easy to top that. Dr. Flowers, can you come up? So I'm proud to represent the Board of Directors of Physicians for National Health Program. And Dr. Flowers is our congressional fellow, talking about personal self-sacrifice and full-time unpaid work. Margaret's personal dedication has been amazing. I just want to say that I think that where we stand now is that we're in danger of underestimating both the moment, the social crisis that we're heading into, and it deepens all the time. This is from last week's paper. For workers at a plant set to close, the ordeal included heart attacks. It's not just that you lose your health insurance when you lose your job. You lose your life. And more, these personal tragedies are properly understood as a social crisis. And what we will begin to understand is that when we fix that social crisis with single payer, we will have personal liberation. And that's what we need to perfect our message. Economic liberation and personal liberation. It will strengthen us at the bargaining table. It will strengthen us against the boss every day. It will win us strength and liberation. And it's that message that we need to tap into. And as for the movement, this was obscured by Obama's great victory. In the state of Massachusetts, a ballot initiative in 10 voting districts read, should the representative from this district be instructed to support legislation creating a cost-effective single-payer health insurance system that is available to all residents and oppose laws penalizing those who fail to obtain health insurance. That's a ballot initiative. 10 voting districts in Massachusetts, 182,000 people voted. 73% voted yes. This is why Martha Coakley lost the election. This reform has been written by the insurance industry. When we say written by the insurance industry, we mean written by Liz Fowler, the former vice president of WellPoint for public policy, now Max Baucus's counsel for drafting the legislation. This legislation is written by the insurance industry. It does more harm than good. It will accelerate the crisis. And everyone knows it. Even if you supported this legislation, it's discredited now already. And so we really could underestimate the moment. I'd just like Margaret to. I know she wants to say hello. Thank you all. Thank you so much for having me. I should also mention I'm very proud to be a shop steward and secretary of Division 231 Public Employees Federation, AFL-CIO. And there are 5 of us here from my union, 60,000 in New York State. So thank you.
Thank you, Andy. I wanted to, thank you very much for giving me this opportunity. I wanted to welcome Larry Camp, a Maryland colleague from UTU and the Western Maryland Central Labor Council, and also Jim McGee, who's here from Maryland as well. Andy said it. This legislation is actually going to codify into law a private insurance-based situation, which is the very problem in this country and the reason why people are suffering. This past year, I took up this work because as a physician, I refused to operate under this situation. I refuse to spend 5 minutes with a patient. I refuse to make them reschedule another appointment because they happen to have more than one issue that they need to talk about. So this is a personal issue for me. And I moved very far outside of my comfort zone this past year. I did it because every single day in this country, too many thousands of people are outside of their comfort zone, their mental and physical comfort zone. And that is not going to change with the legislation that is being passed this year. And so what we have learned is that we did not have a single leader who stood up and stayed strong to fight for those people who are suffering and dying every day. And what we need to do, and this is moving outside of our comfort zone, and I have moved there, and I hope you will move with me, is that we have to create an independent movement. We are about health care for every person. And you're either going to work with us. I hate it because I really hate George Bush. But you're not working with us. We need leaders who are courageous, who are willing to stand up and say, this is what we must do because it's unacceptable where we are right now. And we have the backbone to stand up for this. So I'm asking you to create a movement that's independent of any political party and that is strongest movement.
That's right.
And make this politically feasible, because we are the ones that determine political feasibility. So I'm asking you to organize, to hit the streets, to become militant, to move outside of your comfort zone, and to demand that if we elect somebody, they're going to stand strong on this issue, and if they aren't, they're not our friend anymore. I'm sorry. So thank you very much.
Man, I'm glad you're in your comfort zone.
That was the statement.